Welcome back. Other news now. 15 African countries have fully vaccinated 10% of their populations. That's according to the latest data from the World Health Organization's regional office in Africa. This is a long way from the WHO's goal of 40% vaccinations by year end. Half of Africa's 53 countries have fully vaccinated 2% or less of their populations. For more on this, I'm now joined by the program facilitator for the regional office in Africa, Richard Mihigo. Richard, thanks for your time. We appreciate it. So this is quite concerning. Only 10% of countries in Africa fully vaccinating their citizens. And we know this was going to happen, didn't we? Especially because of vaccine hoarding. Why haven't we made enough movement in this regard?
Well, thank you very much for the invitation for your show tonight. Yeah, definitely. This is a very concerning situation, having only 15 countries on the continent that have reached this important milestone of vaccinating at least 10% of their population by the end of September. One of the major factors that is making country lagging behind has been really an issue of supply. The supply have been a major bottlenecks to facilitate the vaccination drive that many countries have already started. So we, WHO, are really appealing to not only vaccine manufacturers, but also healthier countries who are hoarding vaccines, really to release those doses to low-income countries so that a country in Africa can be also able to vaccinate their at-risk population.
Is there a problem with hesitancy in countries that actually have access to vaccines? We know in South Africa, that's one of the concerns here. People are not going to get vaccines even though we have doses. Government's now going on an intense campaign to actually encourage people to get vaccinated. Are you seeing that in other parts of Africa or not?
Well, it's true that the social media, rumors, misinformation, and it's very unfortunate to hear before this interview, your other guests who were putting in front theories that are not based on fact or on science. I think it's such a belief that are making people doubt about vaccination. But the good news is that across many countries in Africa, the major issue that we've realized is that people don't have the supplies. If you go outside the capital city, outside the major metropolitans, I think the vaccine is become really a real issue. So we cannot minimize the rumors. We cannot minimize the fact that some misinformation has led to rumors and hesitancy. But I think when we looked at the overall picture, what the major problem in Africa that is preventing people to get vaccinated is just supply.
Yeah. So COVAX was supposed to be the grand plan when it came to actually getting vaccines across Africa, right? We know that there were issues, especially since companies like Johnson & Johnson, Pfizer, etc., sold off their vaccines to richer nations. And COVAX was left waiting on other doses like AstraZeneca that didn't prove very successful in terms of the efficacy. Where are you now in terms of securing vaccines for African countries?
Well, let me first maybe correct one thing. AstraZeneca is proven. It's a very good and efficacious vaccine. Wherever it has been rolled out, I think it has saved lives. And it is a product that has been listed for emergency use by WHO. So we do advocate whenever that product is available to be used. But coming back to your question of COVAX, it's true that the COVAX initiative was created with the promise of global equity, really to make sure that that was supposed to be the instrument that was going to provide vaccines, particularly to low-income countries, knowing very well that at the beginning of the pandemic, most of the vaccines that were still at the production level were already being bought by healthier countries. And even the contract that were passed by COVAX with other manufacturers like in India, when the outbreak became out of control in that particular country, there was a stop of exportation of the product. So the real challenge that COVAX ran through was really to get access to the supply, even when the money was there to buy the supply. But the situation is starting to change. We are starting to see more supply coming. In September, for instance, we received through the COVAX more than 26 million doses, which is more than what we saw in August and even the previous month. And the prospects for the coming month, though not necessarily in line with the forecasts that were put forward before, are showing that the product are going to continue to flow through COVAX, protecting more lives in several countries in the African region.
Yeah, thank you so much for your time. I think I should have said and been clear that AstraZeneca was flagged in South Africa because it wasn't as effective when it came to the beta variant that was discovered here. Richard Mihigo.